Hi everyone, I'm Dr. Brandon, and today I'm here with my lovely patient, Erin, and I'd like to go over the consultation process. The consultation process is extremely important. It's our first chance to get to know each other and to understand what your concerns are, for me to evaluate what may be an appropriate treatment plan, and to make sure that we're on the same page with our goals, to make sure that you have realistic expectations and that I can meet those expectations. So it's an incredibly important step of the process. So typically I like to start my consultations by understanding what is bothering you. What do you see in the mirror that you want to improve? And some patients come in and ask me, they say, you're the plastic surgeon, I'll give you carte blanche and you can do whatever you think is necessary. But the thing that you have to realize is that my eye may be trained to see something that's different than what is bothering you. And instead of recommending something that is not bothering you at all, I like to focus on what is your goal and what we can do to achieve the improvement for you. So Erin, what brings you in today?
My main concern personally is I would like a little bit more refinement in my jawline. I feel like my whole life, no matter what I've tried, filler, anything else, I've never been able to get that kind of chiseled jawline. So that is my main goal, and I wanted to explore what my options are for that.
Now, is this something that you've noticed, whether your weight has gone up or down, or has it just always been there?
No matter my weight, it has always been like that.
So Erin, when we take a look at your neck and jawline, you can see that you have a very nice jawline here, but there is a little bit of fullness underneath. And when I actually feel the skin, I can tell that there's not very much fat underneath the skin. So that means that fullness that you have is due to the deeper layer of fat that we were talking about earlier. It's called sub-Liposuction fat. Okay, Erin, so with your concerns in your anatomy, I think that it's necessary to treat the deeper layer of fat. That is going to give you that chiseled jawline, that refinement underneath your chin that other techniques would probably fall short of. So that's why ultimately I'm recommending the Deep Necklift as a better option for you. So the next step in the process is the preoperative visit. This is a very important part of the process. This is where you and I will meet and we have a chance to go over all of your questions and make sure that we're on the same page. We'll go over the details of your procedure, what the procedure will entail, what the recovery will be like, what you should expect afterwards as far as pain, downtime, those sorts of things, and then also any other questions that you may have.
So with this surgery that you're suggesting, what is my expected downtime and like my limitations, and when do you think I'll be able to see my final result?
I tell most people to plan on about a week of social downtime. And by that I mean you may not feel comfortable going out to dinner, going out in public. For some people that don't worry as much about that, then you may be able to get back to work much sooner than that. And as far as pain goes, I would say mild pain, and it's more of discomfort. This will feel tight, maybe a little swollen, but not overtly painful. Combination procedure called Sub-Liposuction and deep neck contouring, and that is to address all the different layers of the neck to get a very nice sharp jawline here and reduce the little fat pad underneath the chin that some people have throughout their whole life, no matter how much exercise, weight loss they have. They always have a little stubborn pad of fat there. So the is a great procedure to help give you a very sharp, crisp jawline. She actually has a ton of what we call subcutaneous fat, which is the fat that's removed by liposuction. Right. More of the fullness that she's getting underneath the chin is from a deeper layer of fat called sub-Liposuction fat, and that's why we're doing a little more comprehensive treatment. Turns out you kind of need that little cushion of fat underneath the skin. Otherwise you start seeing some of the deeper structures through the skin. That doesn't look good either. So it's a balance. Make an incision in the platysma, which is the muscle that covers the deeper structures. A fair amount of what we call subplatysmal fat. Expected. Standard procedures like liposuction or non-surgical things like fibella will not necessarily make a big improvement for her. I think you might be just a touch weak on the one side there, but that's because that's the side where we did some more of the. Oh my, that is gonna look good. So everything went fantastic with Erin's surgery. She's only, I would say, maybe 24 hours out at most. So it's the next morning. She looks great. Pain has been well controlled with just Tylenol, and I think she's doing fantastic. So we just went over some basic care for her. I do want her to wear a little compression chin strap for the next 4 or 5 days, and that's just going to help make sure that there's no fluid collection underneath the skin and she heals as well as she can. She has a couple little stitches underneath the chin and just a few little stitches behind the ear that she's going to apply antibiotic ointment and peroxide to twice a day. Other than that, she just needs to take it easy.
Hi guys, so this is Erin. She's our patient here after her deep neck contouring. She is currently on day 6 and she has some little sutures underneath her chin. We're going to remove those today and then she can go home suture free.
So today I am day 6 post-surgery and I'm honestly feeling really good. The process was very easy. I was never even really in any pain. Main thing was just discomfort and really like kind of tightness of the neck and shoulders from having to kind of hold your head still. The whole process was so easy. I took Tylenol for a day and a half. That was it. Very little bruising for me. I had a little bit of bruising here that's pretty much gone now and I feel good. I feel like some of the things that really helped me have a speedy recovery are a good diet pre-surgery and post-surgery. So low sodium, low sugar, high protein, really staying hydrated, lots of fresh vegetables and fruits. I really focused on that prior. Post-surgery, I did have to have a little bit of a softer diet with pretty bland foods as directed by Dr. Brandon. Another thing that's really helpful was sleeping kind of sitting up at like a 90-degree angle. Anything that really took like the pressure off of holding my head up, that was like the biggest relief of all. So really just propping up like my lower back and my head with a bunch of pillows and resting as much as possible. So for day 1 after surgery, I had my follow-up with Dr. Brandon the following morning, and that's where we took the head wrap off, and he removed my drains. And I mean, the next couple days I really couldn't do much of anything, just rest a lot. So for swelling, I really didn't have much swelling at all, and I feel like for me personally, I can contribute that to my diet prior and post-surgery. My swelling, I feel like really peaked day 2, and then even the morning of day 3, I would say, I could see a difference because I would take photos of myself every morning and compare. In day 3, I definitely saw a difference, and every day since then, it's just been gradually feeling a little bit better, like a little bit less puffy per se. I'm just excited to see the daily progress.